Good afternoon. Hello, everyone. Thank you for joining us for our regular Whole Green Health live stream. And I welcome all of our patients who've made time to join us this afternoon. And also thank you for submitting your queries, your questions with themes and queries with regards to areas that you want addressing during the live stream. So with us today, we've got Jamal Saeed. He's one of our managers who's coordinating the live stream. We've got Dr. Masood Nazir, and we've also got Dr. Anne Cartmill. For all of you who don't know me, I am Dr. Irene Abdul Razak. I'm one of the partners at Whole Green Health. I've been recently appointed as managing partner, taking over from Dr. Nazir's leadership years since the 1st of May. So in Whole Green Health, the tenure runs for 3 years. So this is it will be my turn to be managing partner from the 1st of May this year for the next 3 years. So we have got several questions that have been submitted. So I think, Jamal, over to you.
Thank you, Dr. Razak. So, we've had a few questions, and before we dive in, the first one is that we've had several people ask for a general update about what's happening at Whole Green Health, and I was wondering if Dr. Cartmill, if I can bring you in to just give us the highlights of this, please.
Good afternoon, everybody. Thank you to everybody who's tuned in live for the live stream today. And hello to everybody who's hopefully watching it a little bit later when you've got in from work in order to catch up on what we're up to here at Whole Green Health. So a general update. First of all, I wanted to talk about access to appointments, as I know that's something that is dear to everybody's heart, really. And for those who perhaps are joining us for the first time on our live stream, or maybe are new to Whole Green Health, I just wanted to remind everyone that there is a national shortage of GPs. This was the case prior to the pandemic. And because of the difficulties in having enough GPs to provide GP appointments for the needs of our patient population, one of the decisions that we took here as partners at Whole Green Health was to increase the team. We invested in developing the team, and we're really delighted that we're a practice that have a lot of other clinicians working with us as GPs. So some of you will have already met and been assessed by our paramedics, our physicians associates, our advanced nurse practitioners, our first contact physio, and our pharmacists. And we're continuing to look at the needs of our patients and to develop the team so that actually, in terms of access to appointments, it's not that the GP does everything or that the GP is necessarily the best person. In a previous live stream, we talked about the impact of the pandemic on mental health, and we're delighted to tell you that in the near future, then we are also going to be having mental health workers joining the team. So we're working really hard to make sure that patients of Whole Green Health have access to professional help and support. Now, in order for us to do that, one of the things that we're doing, and in fact have been doing since well before the pandemic hit, is asking you to let us know why you want to be seen. Now, this can be done through the online form, or it can be done when you're on the phone speaking to our receptionists. And the more you tell us, the better able we are to identify who the right person is to talk to you about the particular problem that you want addressing at a particular time. I would make one request though. If you are using the online form, then please just submit the form. They are looked at in as quick a turnaround as we can manage with the staff, and certainly within a couple of hours of that request coming through. Please don't send the request through and then just because you haven't had a response back within a couple of hours, then go on the phone. please, if you can use online requesting for an appointment, please do so, because that frees up the phone lines and our reception team to deal with people who aren't able to use the technology, or aren't as familiar with it, or are uncomfortable using it. So if you can use the technology, please do so, because that then means that we can ensure that you get directed to the right person in the right sort of time frame. So this isn't really an update, it's really just reminding everybody that we're going back to how we have always been doing things in the 12 to 18 months in the lead up to the pandemic. And we continue to do this through the pandemic, but it was always via a phone call. If you have a problem where you're going to need a face-to-face examination, then rather than a phone call and then a face-to-face examination, if the doctor or clinician feels that that's what's required, if you give us the right information straight off, either in the phone call or on the online request form, then when the clinician looks at that information, if it is clear that you're going to need an examination, then it's likely that you will be asked to come in for a face-to-face appointment straight away, rather than having to speak to someone first. So that's something that we've moved back to, and is an update from how we've been doing things throughout the pandemic. So again, the clearer the information you give us, the better we are able to help you. So the other thing that we're doing now, as we're entering our recovery phase following the pandemic, is we're starting to recall all those individuals who need regular monitoring because of their chronic disease or an ongoing problem. So during the pandemic, we were continuing to do blood tests and seeing face-to-face those individuals who were on high-risk drugs. And then as we were coming out of the pandemic, we started to call in, for example, those patients with diabetes, where their control is less good than in other individuals, because they're at highest risk. As we're coming into the recovery phase, we're going to be calling more and more of you in for those reviews. So I know some of you will be delighted not to have been pestered by us over the last 12 to 18 months. But that does mean that the time has come now where we do need to review you. So if our recall team contacts you and asks you to book an appointment for review, please do book it. And more importantly, having booked an appointment for review, please do make sure you come. Appointments with all of our clinicians are at a premium now. We want to continue to give you the service that we value and that we know you value. But if you can't make an appointment for whatever reason, then please do cancel it. And we've made cancelling it really easy by going online via our website to cancel appointments. Then the third change that's been happening is during the pandemic, we kept Shirley Road as a highly protected site for those individuals who were most at risk. Now that the numbers are going down and we're entering the recovery phase, we're returning Shirley Road to more normal working. We are still asking patients not to simply just turn up. Wherever possible, please contact us by phone or online first. And as I said, online would be preferable if you have access to that technology and are comfortable using it. Because, as I said, this allows us to make sure we're directing you to the most appropriate person in the most appropriate time frame. I would also ask that if you disagree with the time frame, then please don't push for a change unless you've omitted giving us some really vital piece of information. The clearer you are, the better we're able to address what you need. And if the clinician feels that the issue can safely wait until you can see your regular GP or a clinician who's more experienced in that area, then because somebody with the training and expertise has assessed what you have told them and has determined the time frame as appropriate, then only get back in contact if you've missed some information, or if you can give further information on why you feel that it's inappropriate and why you feel things need to change. hopefully that will be a very, very small number, provided you give us the information that we need straight away, because we're trying to do our best to help you and ensure the appointments are used sensibly and appropriately. So I hope that's enough of a general update. Obviously, if there are further questions as a result of that, we'll take them later on in the live stream. But that's it from me for now. Thank you.
Thank you, Dr. Cartmel. That's been really useful. Lots of important information summed up there. So the next one we've got is that there's been a lot of announcements around COVID, around lockdown easing, around the vaccination program, and we're just if Dr. Razak, if you could give us a little summary to our patients about what these announcements have been and how it might affect Whole Green Health and its patients, please.
Thank you, Jamal. As you know, the Whole Green Health, working with our two PCN practices, our close-by practices, Northbrook and Swanswell, has been a COVID vaccine delivery site. And to date, we're happy to announce that we've delivered more than 20,000 COVID vaccinations. This is a big milestone for us, considering, you know, we were still offering general medical services and whilst hosting the vaccination program. So it's been a huge achievement for all those involved. And thank you for our patients for continuing to come in to get their COVID vaccinations. The government guidance, as you know, there's been a couple of big major changes. The first one being that for all 39-year-olds and under, for first dose vaccines, it is recommended that the Pfizer vaccine is to be offered first, unless you've had AstraZeneca the first time. And if you had no problems, you can still have your AstraZeneca second dose. But for first doses, 39 and under, you will be offered the Pfizer vaccine from now on. The second big change is actually with regards to second doses. So the second doses for both vaccines used to be at a 12-week interval. So the latest guidance for 50-year-olds and over, the government's brought that down to 8 weeks. So you will be getting a contact for your second dose at 8 weeks and not 12 weeks as previously advertised. The other thing that we need to just remind our patients is once you've had your first doses, you will be contacted for your second doses. So you do not need to ring and find out when your second dose is. Should you think that it's coming up to your second dose timing and you've not been contacted, there is a special dedicated line. So please do not queue in with the queries for general appointments. There's a dedicated COVID line for you to use. But on the main, really, we will be contacting you. There will be small cases where, you know, perhaps things have been missed, but the average majority of our patients have been contacted for their second dose at the right time. Going back to Dr. Cartmell's mention about us, you know, opening up as part of our recovery plan, in line with government guidance, we are opening our front doors. You know, as you know, previously patients would need to have had an appointment before coming to the practice site. We have opened our front doors. We are still implementing temperature checks, you know, using alcohol gel, asking our patients to use masks. We do not encourage people to come in if their queries can be addressed via the computer, via online means and on the telephone, because we are still trying to limit the number of patients on site whilst adhering to the strict social distancing. Over to you, Jamal. That's all from me regarding.
Sorry, Dr. Razak, I think I cut you off slightly there, but thank you. A really useful COVID update and very nice and clear to tell us what we need to do and why. And one of the kind of last main question we've had, which has generated some interest, is around our new appointment inquiry form, and it's generated a number of questions, and it's a little different from our old one. And Dr. Nazir, I'm going to ask you if you could explain what the new form is and why it's so important to us and how we provide effective care. And then I'll lead on to the next question, which is linked, which is that there's been a lot of questions surrounding a COVID vaccine passport. And if you could just explain how the NHS has gone about making this available to its patients as a general, and how we are going about that, please.
Thank you, Jamal, and thank you to everybody who's joined today. And again, really important questions. Let me just probably start by giving a bit of context. In more recent weeks, there's been a significant strain on our phone systems, mainly because there's been quite a lot of anxiety associated with people who've had to wait a long time for hospital appointments, some confusion about the vaccines and who's eligible, so we had lots of questions about that. And in some cases, people have just, they've been holding back for quite a long time about things they're worried about. And it does mean people are ringing. People are still ringing, trying to ring at 8:30 in the morning. And it does mean many times our phone systems are inundated. And if you ring at 8:30 in the morning, it's much more likely there will be 50 people ahead of you in the queue. Whereas if you ring later in the day, it's different. A lot of people ring and then expect the phone to be answered within a minute. And unfortunately, when there's 50 people on, no matter how many staff you try and put on, it doesn't work. Which is why we recommend that actually routine things like prescription queries, wanting access to blood test results, or something, chasing things, we ask you to do later in the day, ideally in the afternoon rather than the morning, which is encouraged. But equally, there are many queries, and because we have a dedicated team that apply to this, where you can submit the queries through an online appointment form. And so just to reassure, the website form and the systems we use are completely secure. Okay, that was one of the main requirements we had before we chose a system where we want you to submit information to us. We would not be choosing a system where the data was, we had no idea where the data was going. Having said that, one of the things we've learned over time, and I remember a few years ago showing people how to use the online website form. People were filling in a form and they weren't sure how much information to share with us. And people were filling in various things to somebody starting with something really basic like pain in elbow, which wasn't enough information for us to make a decision. And so inevitably what happened is we would then end up with a clinician ringing the patient to get more information and then make a decision about what to do next with them. And as Dr. Cartmill described earlier, we're really keen to make sure that you end up in front of the right person the first time round. There's a lot of demand, and there are things which actually clearly a pharmacy could deal with because they're simple things. For example, somebody's had a bit of an upset tummy or a slight temperature for a day or less than a day, and pharmacists can and are very capable of being able to manage these things easily. Something more complicated needs to be seen. And in some cases, people are that unwell, they need to be seen straight away or go to hospital. And the more information we have, the easier and quicker it is for the clinician looking at that to make a decision. So the reason we introduced a new system and the new online system, a new form, is it allows us to capture a bit more information. We had to get a balance between asking you lots and lots of questions to a few questions that allowed us to make a more informed decision about the reason you were reaching out to us for help. And so it is really important that you help us complete that. It is completely secure. It is clinicians who are looking at that information, okay, and making a decision. And what they then do is decide who the best person in the practice is to see you. And if it needs to be done the same day, or it can wait for your regular clinician. So it is a really important form. So thank you to all those who are using it. And those of you who haven't used it, please use it. And if there's anything about it you're not sure about, we will try. And I've asked Phoebe, who normally helps us run these live streams, who's our social media and communications manager, to do some more videos on it. And we will show you how to use it. If you can't use it, then please continue as you normally do and contact us by phone. But the more of you do use it, we will respond to very quickly, and we will make sure that you get the right outcome. But it will then ease some of the pressure on the phones for people who haven't got access to this technology. A lot of people nowadays have. So I'm going to encourage you that you please do use these forms. And if there are things about it that don't work, do let us know. We will continue to improve the system. But it does help, okay? And it does help us work out what we need to do to help you. And that's why we've got the system in place. The second thing I've been asked to do is explain about the COVID passport. And many people may now be starting to think, as guidance is being updated, that they wish to travel in the summer and the places they want to travel to. And some of those places you travel to will want evidence that you've had your COVID vaccines. And the government guidance is very clear. Nothing we provide can demonstrate that. But if you sign up for the NHS app, and again, I've asked for that to go onto our website, how you do it, and also how you download it. The NHS app okay, you can register for that. We'll be able to provide both evidence of your 2 vaccines and a QR code, which you can then show at the airport, wherever you're traveling, to demonstrate you've had your COVID vaccines. If you don't know how to, if you don't want to use the NHS app, there is a phone number 119 which you can ring and contact somebody who will then be able to provide you or send you a letter to yourselves confirming you've had the vaccine. The practice, unfortunately, is not authorized to do that and will not have the facility to do that. So, unfortunately, there's no benefit to you in contacting the practice for evidence of your COVID vaccine status. And again, I've asked that we make it clear on our website about how you download the app, but also the number you need to ring if you don't want to use the app as evidence for travel. I think those are the 2 areas I was asked to cover off. And I'm happy to take any further questions that we have about this. But I will reiterate, the information you give us is really important in helping us assess you. Okay, we want to make sure the right people get seen in a timely manner. We cannot do that without the information you share with us helping. Otherwise, what we'll end up doing is just giving appointments to people who ask for them, and find that we give out appointments and they've all disappeared by 9:30 in the morning, and the people who really need to be seen have been told to go elsewhere. Okay, to go to a walk-in centre or to go to the A&D department when actually we could have seen them. So we have to be, very pragmatic about the way we assess people, and the information you give us helps us to do that. Okay, Jamie, back to you, Jamal, and happy to take any questions.
Thank you, Dr. Thank you, Dr. Nazir. I think just before, there are a few questions and around it, and I'll bring those up in momentarily. I just think at this point it might just be worth quickly showing our patients how exactly they can get to this form. So I've just loaded up our website on here, and you can see it's on there, and it's just on the left here in this little menu where it says appointment inquiry form. And once I click on there, it's going to redirect me. Please don't be alarmed that you're being sent to another page. This is a secure page, as Dr. Nazir mentioned. It is secure. We're currently working on embedding it in our website, but it is part of us. It is ours. So please don't be alarmed at all. Let me just remove it, and then I'm going to bring Dr. Nazir back in, and I'll put the questions up. So we've had a question from that you've already answered. Thank you. Just that was, is it secure? And you are happy to confirm that yes, we've chosen a secure website.
We have. Thank you to Lee for the question, Jamal. And so Lee, again, it's part of our responsibility. It's always our responsibility to make sure your information is kept confidential and secure. So we wouldn't be choosing any product. So please, feel confident to be able to use the website and submit the information, knowing that actually it's kept secure.
Thank you. And then our next question is, should we also use the NHS website to ask for an appointment? So if you just want to cover that. Yeah.
Thanks, Christine. So again, Christine, when asking for an appointment, what helps us is when you give us some information. So yes is the answer. Please do use that. It's the same people assessing it. If you were to ring, or come in person, and ask for an appointment, we go through the same process. We ask you for information, and then we ask a clinician to assess it. So when you do use the NHS website, please give us the additional information for why you want the appointment, and any specific things that you would help that would be useful for the clinician to be aware of. I'd like this appointment for this condition. I've seen this person previously. This didn't work. Symptoms getting worse. Really important bits of information that would help us make sure that you get the right appointment with the right person in the right time. Yeah.
Thank you. And then the last question, it's quite wordy, but it's the summary is that they weren't able to get all the information because they were answering on behalf of someone else. And what's the best way to go about filling out a form like this when they have to guess about some of the questions? I'm just going to remove the question just as it's hiding your face, but that's the question.
And it's a really good question. I've got a brother and a nephew with very similarly. My brother shares his frustrations about some of these forms. I have given clear direction that actually explain the circumstances that you can't answer all the questions, and that in itself should help us prioritize it. Equally, and if you're struggling with the form, what we want to do is make it really easy for people to contact us by telephone. That's the reason we want some people to use the form. But in your case, I would complete the form and actually highlight why you can't answer all the questions. There should be an opportunity for you to bypass some of the questions. And if it isn't working, and do let us know. But just explain the circumstances that you can't answer all the questions. And that in itself will allow the clinician know that actually in your case, it's better for us to contact you and get the additional information or assess you. And it may mean that in your case, we need to organize to see you face-to-face, which is appropriate. But then when you do organize that face-to-face appointment, we can allocate your time and make sure when you do come to the practice, we're not keeping you waiting. We understand your circumstances, and then make sure that you and your son are looked after.
Thank you. And there's just a little follow-up kind of comment from Christine that I thought was worth sharing for you, which is just that thank you. She finds it easier using the online request and not to bother us by the phone. And the more people that are able to do this, it's very helpful. So thank you, Christine.
Absolutely, Christine. And thank you to all of those. Like I said, you are helping other people who haven't got the access to technology. But thank you so much for that comment.
Okay, I'm going to just pass back to Dr. Razak now. So just add her in and.
Can you hear me now? I think I was muted. I apologize. Thank you, everyone. I hope those answers your questions regarding the various aspects of queries. I would like to thank everyone who's been present today and those who choose to join and re-listen to this at a later time. Whilst we really value these live streams, I think we also miss the face-to-face events we used to have. So definitely, depending on government guidance and how the pandemic pans out, it will be nice to meet everyone again, and perhaps we should pencil an event with our patients as before a face-to-face event sometime perhaps in the summer, condition permitting. If that's all, we'll call it a day, and perhaps we'll join all of you again in the next live stream. Thank you.